or you're buying your own plan through the marketplace, each year during open enrollment, you're faced with options to choose from. So there's a lot of other factors to consider besides premium in determining the best plan for you. So we'll be analyzing summary of benefits, looking at out-of-pocket costs so that next time when you're shopping plans, you'll be more confident in choosing the right plan. Please note that these plans are for those under 65, not on Medicare yet. Most people on Medicare have already discovered that coverage is way more affordable and amazing. So let's begin. So the first thing we're going to do is analyze summary of benefits. You should be able to obtain a copy either through your employer at work or download it off the marketplace plans. So it doesn't matter which carrier you're looking at, they all pretty much have the same format. This first one is through Blue Cross Blue Shield of Texas. It is an HMO. And what I normally do is skip over to the second page. And the reason why I do that is because if you're in good general health, you're more likely to use primary care visits and urgent care visits before you would need to meet that deductible for hospitalization or surgery. So the preventative care should always be no charge, deductible does not apply. And those are services such as wellness visits, your annual PAP, your wellness mammogram and wellness colonoscopy, and also immunizations. The next thing to consider is primary care visit. Do they have a copay, or do you have to meet your deductible prior to them covering treatment? So on this plan, the first 2 visits are just $40 each, and then after the second visit, the third visit, you would have to meet your deductible and then 50% coinsurance after that. So specialist visits, it says 50% coinsurance. Now keep in mind, unless it says deductible does not apply, then you have to assume that the deductible applies. So see right here, all copayment and coinsurance costs shown in the chart after your deductible has been met if a deductible applies. So unless it says deductible does not apply, always assume it does apply. I'm going to skip on over to page 4 because this is where you're going to find your co-pays for urgent care or ER visits. So for urgent care here, it says deductible does not apply, which is great. So all it means is if you need to go to urgent care, you pay $60. Now, if you have to go to the emergency room, you're going to pay $950 plus 50% coinsurance. Now, it doesn't say here deductible does not apply, so we have to assume that you need to meet the deductible prior to them paying for this visit. So anything outside of that, you're going to go back to the first page and see what your deductible is. For an individual, it's $6,000, meaning if you have a $100,000 procedure, the first $6,000 you would be paying 100% out of your pocket. And then what you're going to do is pay your coinsurance up to an out-of-pocket max. So let's just say you needed to go in for surgery. Then in this case, what would happen is you would pay the $6,000 deductible, and then at a surgical center, you would pay $600 visit plus 40% coinsurance. So they pay 60%, you pay 40% up to your out-of-pocket max. Now, note here that a freestanding facility like a surgical center versus a hospital, notice that your cost is cheaper if you go to a surgical center versus a hospital, because on a hospital you're paying 50-50, whereas a surgical center, they're paying 60 and you're paying 40%. So the out-of-pocket cost in this plan is $7,900. This is the most that you would pay, even if all goes wrong. Now, what it doesn't include is your monthly premiums, if you're balance billed, or if you seek coverages that are not covered on this plan. So another thing to keep in mind is that this plan is a HMO, meaning if you see someone not in network, then you're going to be paying 100%. So see how it says non-participating providers, not covered, not covered, not covered. So the other thing to keep in mind is also, does your plan require a referral for a specialist or prior authorization before surgery? So in this case, it's always on the first page. Do you need a referral to see a specialist? Yes. Okay, so that's very typical of an HMO. And then also prior authorization. So if you have to have a diagnostic service, imaging, or anything like that, prior authorization may be required. Emergency room, none. No prior authorization. However, if you're hospitalized, then you're going to need prior authorization. So usually read the limitations here, but it should give you an idea of, here's an example of, hey, if I have to stay at a hospital or if I'm pregnant, here's my costs and here's the limitations. And then the next thing we're going to look at is prescriptions. So prescriptions are usually on the third page, and notice that the cost will go up depending on your prescriptions, and I'll show you how to know which tier your prescription is. But the lowest tier is usually tier 1, and that's going to be the lowest out-of-pocket cost for you. So usually tier 1, tier 2, tier 3, tier 4, tier 5, and then once you get to tier 4 and above, I would have to say it's pretty expensive prescriptions. So in this case, the preferred generic drugs, things like high blood pressure medicine or cholesterol meds, you're going to be paying out of pocket $15. And notice that it says deductible does not apply. So the deductible doesn't apply to tier 1 and tier 2 drugs, but on the preferred brand drugs and higher tier drugs, it doesn't say deductible does not apply. So in this case, your deductible is going to be $6,000 before they'll chip in for your tier 3 or higher prescriptions. Okay, so it says it very clear here. Some prescription drugs are covered before you meet your deductible. So that would be the tier 1 and tier 2 drugs. So let's look at one more summary of benefits as an example. This one is Blue Cross Blue Shield of Oklahoma. They happen to have PPOs available in that area. Now, this person happens to not only qualify for a tax credit, but she also qualified for cost-sharing reductions, meaning co-pays and deductibles are much less for her. So I'm going to look on the second page here. Preventative care is, of course, no charge. Primary care visits are only $10, and it says here deductible does not apply. Now, if she were to go to a specialist, it's 50/50 coinsurance after the deductible has been met. So let's see here, urgent care visits, 50/50 coinsurance after the deductible has been met. Emergency room, $950 plus 50/50 coinsurance after the deductible has been met. So let's go back to the first page and see what her deductible is. Now, this is a PPO, so she can choose to go out of network, but the out-of-pocket costs will be more. So if she stays in network, her deductible is only $1,050. If she chooses to go out of network, it's a separate and higher deductible, and that's $3,150. Her out-of-pocket costs for a in-network providers is $6,300, while if she goes out of network, the sky's the limit. So she doesn't have a max out-of-pocket if she chooses to go out of network. When you're looking at coinsurance, you'll notice that if you have diagnostic services such as x-rays, blood work, CTs, MRIs, notice that there are freestanding facilities which are otherwise known as surgical centers. The coinsurance is a lot cheaper than if you were to have those same services performed at a hospital. So they pay 70% and you pay 30% versus 50/50. Or if you go out of network, it's 50/50 coinsurance. Okay. Now, notice that with the PPO, do you need a referral to see a specialist? No. So that's a nice thing about having PPOs, but keep in mind that prior authorizations are still required. So the last thing we're going to do today is compare plans on marketplace plans. So many of you are going on to healthcare.gov and searching for your own plans. So what I'm going to do is show you a couple things to keep in mind. Choose a random zip code. This person is a female, 50, and she makes too much to qualify for a tax credit. Now, usually on the left-hand side, you should be able to narrow down and filter out options. So networks is kind of important. That's one of the first things I look for. If it's a HMO, POS, or PPO. Now, HMOs are basically, you have to stay in network and you have to choose a primary care physician and get referrals for every specialist that you need to see. PPOs, generally, you can choose whoever you want. And if you choose someone out of network, you just pay a higher out-of-pocket costs. POS, which stands for point of service, is like a hybrid of both. So you'll still have your primary care provider, and that primary care provider is responsible for referring you to see specialists. You can see in or out of network doctors. Now, one of the things you're going to want to do is, if you have a primary care provider that you really love and you want to make sure they're in network, then you want to plug in their name. So let's choose this person. And then we have John. Okay, so I've included 2 random doctors here. You hit apply, and as you can see, this first doctor they'll take any of these plans. However, the other doctor does not take any of the marketplace plans. So that's definitely something to keep in mind when choosing your plan. The next thing you're going to want to do is usually there's a spot to type in your prescriptions. But what I will tell you is I have found that usually typing in your prescriptions is not very accurate. So what I normally do is just click on the prescription list where you can look up the formulary. So sometimes they'll have a handy search engine like this, and sometimes they'll have you download a PDF. If it's a PDF that has all the formularies, all you would have to do is do a Control F to search your prescription to look up the tier. So what I'm going to do is Cinepro. I type in a prescription. Okay. Now the Cinepro is a really cheap prescription. It says tier 1 here. Okay. So what we're going to do is take a look at that summary of benefits and see what that means for us. It's usually on page 3. Now it says here, no charge, no charge, no charge, no charge, no matter what tier it is. Now what this means is not that, hey, you get these prescriptions for free. Remember that if it doesn't say deductible does not apply, that means you have to meet the deductible prior to them chipping in for your prescription. So in this case, are there other deductibles for specific services? Yes, prescription drug coverage combined with medical. So that means that you have to pay $6,600 out of pocket prior to them chipping in for your prescriptions. Okay, so don't look at this and say, oh, no charge, great, this is great prescription coverage. It actually isn't. So on most plans that I see, tier 1, tier 2 drugs at least has a small copay prior to the deductible being charged. But also keep in mind that tier 1 drugs are usually very inexpensive. So probably Listener Pro would be, under $10 cash at Walmart. I'm going to look up one more drug, and that is Lantus. So Lantus is an insulin pen, and notice that it's a tier 3. So again, tier 3, you basically have to meet your deductible, and then they'll chip in to pay your prescription. Now, if you want to look up providers and check to see if certain hospitals are a network, all you have to do is click on the providers link, and usually it'll open up to the provider search engine. So what I'm going to do is type in the zip code, and you could either do a category. So you could search by the doctor's name, specialty, or place, or type. In this case, I'll put in hospital. Let's see who is in network. So you click there, and you can actually narrow down the radius. Okay, so it tells you which providers are in network. If you're not picky about who you see and you want to find a new primary care provider that accepts this plan, you just type in primary care provider or hospital or urgent care, and there you go. So in conclusion, there are many other factors to consider besides price to choosing your health insurance options. Keep in mind your out-of-pocket costs. The lower the copays, deductibles, coinsurance, and out-of-pocket max, the higher your premiums will be. Network coverage to consider: if your doctors are a network, do you have the option to choose your provider, whether they're in or out of network? If you're traveling outside state, are you covered? Some important things to consider if you do a lot of traveling. Also, referrals and prior authorizations. Prior authorizations are getting more common, but referrals may or may not be required. And the last thing to consider is prescription coverage, especially if you take name brand drugs. Remember, every situation is different, so feel free to reach out to me if you have any questions. Malia at customizeyourinsurance.com. I hope you found this video informative. I would love to hear some feedback from you, so feel free to comment below. Thank you and have a wonderful week.